my name is Biana. I'm a second-year rheumatology fellow at the University of Arizona, and I'm presenting an interesting case titled "From Head to Toe, There's No Place These Cells Won't Go." So essentially, this was a female at around 37 years old. She had a long-standing history of some kind of undiagnosed or undifferentiated pancreatic mass, which was diagnosed in outside country. Never really had a thorough workup, but she presented with fever, headache, productive cough. She also had very poorly controlled diabetes and frequent hospitalizations for DKA, just kind of some difficulties with managing those sugars, and had some recurrent hospitalizations. Initially, when she was hospitalized in our facility, she actually had some diffuse lymphadenopathy, which was present probably for over a decade, or had been brewing for over a decade, was ultimately biopsied, and she did have a biopsy which was positive for the IgG4 related disease. So knowing that this was going on for well over a decade, we had a pretty diffuse, advanced condition. She was treated initially with just prednisone at that time, and unfortunately was lost to follow-up. So unclear if she ever got the full kind of prednisone treatment that was indicated for the IgG4 related disease. However, she continued to have these recurrent hospitalizations for a worsening skin wound. So ultimately the skin wound was biopsied, and this was before rheumatology was involved. So unfortunately that IgG4 stain never got sent off. However, despite antibiotic treatment, despite skin graft attempts by some surgeons, the skin wound never really improved. Ultimately, she got an outpatient PET scan somehow approved, and we noticed that she had diffuse body involvement, indicating involvement in her kidneys. She also had some skull base involvement, so uptake in the skull base, and then started to develop some labs which were indicating that her kidneys were starting to fail and showed some kind of renal insufficiency. So once that renal biopsy was actually obtained, she actually had the classic findings, the storiform fibrosis, and that's when rheumatology actually got involved. We were called, we were consulted, we were able to come in, try to come up with a more regulated prednisone taper, also getting endocrinology involved to try to get that diabetes a little bit better managed. And then we tried, or we're currently in the works of trying to get her approved on rituximab therapy. Ultimately, the whole point of this case report, and to kind of look at how a very long-standing IgG4 related disease can, number one, go undiagnosed, and kind of the implications of what can happen when it goes on for so long, and the fact that it was involving anywhere down from her feet, so this wound in her lower extremities, all the way up to her skull base. So just kind of an education point that if patients are coming in and they're diagnosed with IgG4 related disease and maybe reluctant to therapy or kind of unsure, kind of just knowing that this can become very widespread. She does not have neurologic involvement in terms of any mental status changes to our knowledge at this time, but knowing that she's got that calvarial involvement, that is one of our concerns. And so it's just important to become very aggressive with treatment, try to get this into remission, and essentially my poster is just a demonstration of how IgG4 related disease can go untreated and all the places that these cells can infiltrate within the body. So thanks for listening to my talk.